Hi, my name is Jeanne Tung. I'm one of the pediatric gastroenterologists here at the Mayo Clinic in Rochester. I'd like to share information with you today about a publication that came out in the November 2013 edition of the Journal of American Medical Association. What was published was a pediatric clinical trial of the use of thalidomide. For those of you who don't know, thalidomide was a drug that was used in the 1950s to 1960s for pregnant women who were nauseous. One of the ways it works is that it blocks the production of tumor necrosis factor alpha. That means it works in the same inflammatory pathway as drugs like Remicade, Humira, Cimzia, and golimumab. It has been published before in Crohn's disease, but this is the first clinical trial, and particularly the first one in children. In this study, which was conducted in Italy, children with Crohn's disease were randomized to either receive placebo or thalidomide. They were given this drug for at least 8 weeks, and they could not use any other medications for their Crohn's. The only other drug they were allowed was to taper their steroids. After 8 weeks, patients who received thalidomide did better than those that were on placebo. In the patients that had clinical remission on thalidomide, they were able to use this drug for 2 to 4 years. The other interesting thing in this clinical trial was that the patients who had failed Remicade, lost response, or actually had reactions to Remicade, some of these patients did also respond to thalidomide. There are 3 major side effects to thalidomide. The first and the most common is excessive sleepiness, or what we call sedation. The other is something called peripheral neuropathy. Peripheral neuropathy is a weakness of the nerves that can show up as numbness or tingling, and this is reversible once you stop thalidomide. The third, and the most important to know about, is that women cannot get pregnant while taking thalidomide, as it causes serious birth defects. So this may not be an option for a woman who thinks that they may want to get pregnant in the near future. This was a small clinical trial, but it does show that patients with Crohn's disease may benefit from taking thalidomide. As usual, you should discuss this specifically with your doctor if you're interested in this. Thank you for watching.